Welcome again to the Wellness Watch podcast. My name is Dr. Lauren Carroll. I'm a physician executive, minister, and speaker. And really, the Wellness Watch podcast is here to educate, inform, and really inspire you to live the life of wellness that God has called you to live. And I've got a really special guest for us today. I'm super excited. Actually, this person has really helped me along with my journey to wellness. And his name is Dr. Pierre Johnson, and I'm going to be introducing him a little bit later on. But I really wanted to talk about just our topic for today. And we're talking about facing fibroids. Fact versus fiction. Now, fibroids are very, very common amongst women in the U.S. I was just looking at a statistic that said that between 20 to 80% of women are affected by fibroids in the U.S. And it seems like it disproportionately affects Black women. And I know just as a Black woman myself, I've dealt with fibroids. I've known people who have dealt with fibroids. And I wanted to tell people a little bit about my own personal journey with fibroids and just to help to give some solutions to folks as well. And that's why I brought Dr. P on. So just giving just a little bit of background about my story. About 5 years ago, I felt a little bit of a hardness in my abdomen. Now, I remember this day so clearly because it actually happened after I ran a half marathon. So I'm a healthy person. I eat pretty good. Don't eat any meat, really. No pork, beef a couple times a year. You know, pretty much a plant-based diet for the most part. And I felt this feeling, this hardness. I'm like, okay, I know that's not my abs, even though I don't have like a 4-pack, but it's not my abs. So I'm like, I know this is a fibroid. So I go to my OBGYN, and at that time, she did order a transvaginal ultrasound. It was around COVID time. The hospital I was working with, they messed up my scheduling. So I ended up not getting that ultrasound. And this was like February 2020. So I actually waited a whole entire year, found another OBGYN and got that transvaginal ultrasound, and it showed fibroids. Now, the thing with me, my fibroids, I really did not have any major issues. My periods since I was little only lasted about 3 days. I didn't have any heavy bleeding, no abdominal cramping, and I had this all along being diagnosed with fibroids. So we decided that we were going to wait. I was going to wait maybe another 6 to 8 months and then go ahead and maybe do some treatment at that point. But at that time in my life, I was underneath so much stress. This is 2021 going to 2022, really wasn't having any problems with the fibroids. I just knew they were there. But then came 2023. It seemed like they just blew up overnight. And honestly, I was getting symptoms like it felt like they were sitting right on my bladder. I was going to the restroom a lot, heavy bleeding during my periods, and just the overall feeling of bloating. And at that point, I was like, what am I going to do about these things? Now, as a woman of God, I do believe in healing. I do believe that God wants us healed. But most importantly, I always believe that I'm going to listen to what the Spirit of God would have said to me, right? So my major scripture that I stood on during this whole ordeal was Isaiah chapter 26, verses 3. And it reads, I'm just going to go to it real quick. You will keep him in perfect peace whose mind is stayed on you because he trusts in you. So I really had to have like perfect peace going into whatever treatment I was going to choose. And around this time, I was able actually to go on Instagram and I found Dr. P, and honestly, after doing some research, I decided that was the way I wanted to go. And I actually wanted to show you some of my pictures from my actual surgery. So when the video is going on, that first video is actually showing what my stomach looked like before surgery. And honestly, it looked like I was in my second trimester if I was pregnant. That's how bad they had gotten. You're going to go to the second video, and it's actually showing just a small surgical incision that Dr. P did. For me, I'm kind of adverse to surgery. I don't want nobody cutting on me. That was like my second surgery. But the reason that I went to Dr. P is I loved the surgical results that I saw from his patients. So he's probing around. He has a hold of the fibroids in that video. And in that third video, like just showing the sheer size of the fibroid and just the struggle that they had. And I'm gonna tell you, my body does not look like what it has gone through now. And then you're seeing a pic of my flat stomach. And then that last pic is I had like 15 fibroids removed. And it was about 5 pounds or so, and if you go to Dr. P's page on Instagram, we'll let him tell you his Instagram handle. There's actually a video of me, like he didn't put my name on there, HIPAA, but it's me. And he's nodding his head. So without further ado, that was my story. And I know there's a lot of women out there, you're having these fibroids, you don't know where to go, you don't want to have a hysterectomy, you want to preserve fertility, and even if you're not trying to have a baby, you want to keep your uterus, right? So I wanted to have us talk to Dr. P so we can see some of those options that are available. So I'm going to go ahead and just read his bio because it is very impressive. So here we go. Let me go down. Dr. Pierre Johnson, aka the Fibroid Slayer, because that's what he says, the Fibroid Slayer, is a minimally invasive gynecologic guru born and raised on the south side of Chicago. He graduated from Xavier University of Louisiana with the bachelor's in biology. He got his medical degree from University of Illinois College of Medicine. He did a surgical internship at Washington Hospital Center, and then he did his OBGYN residency, Southern Illinois University School of Medicine. As the oldest child of a single African-American woman of 5 children, Dr. Johnson has witnessed the negative impact the implicit bias has had on our communities, and he has vowed to dedicate his life to fighting to end healthcare disparities. And through extensive training and vast experience, Dr. Johnson has developed the niche to surgically manage the most difficult gynecological cases. He professes that no fibroid is too big to manage, and every woman should have the option to preserve her uterus. All right, welcome, Dr. P. How are you doing this evening?
I'm doing awesome. Blessed.
Wonderful, wonderful, wonderful. Thank you so much for just coming on in the show. And just hearing a little bit of the story, and I'm gonna tell you the surgery that I had was just miraculous. I'm out here doing 5Ks, 15Ks, about to do a half marathon, and I'm not even like 6 months post-op. So results speak for themselves. But I just want to learn a little bit of background just for folks who don't know you. What really got you into just this area of medicine, OBGYN, and particularly working with women with fibroids? What really motivated that?
That kind of happened organically. I mean, I've always wanted to be an OBGYN since I was a kid. I was fascinated with childbirth. Just, quick to the story, I was fascinated with childbirth as a child. And just knew that OBGYN was my path since very early. I started cutting hair at a very early age. Like I was 14 years old to start cutting hair, and just really realized I was really good with my hands. And so as I pursued it, I knew I was going into college to study medicine and do those things, but it kind of evolved from just like being somebody that's going to deliver babies to more so as looking into the surgical aspect of the profession. And so through medical school, through, residency, as I got to reading about, the first page you open up was about J. Marion Sims as the father of gynecology. And then I started learning about what he actually did to slave women. And torturing them, and everything that we know now, gynecology really just happened off the backs of slave women. So for me, just learning about the healthcare disparities that still exist now, that are not much different from how they were, in damn near slave times, I want to see an impact for our people. And, fibroids is one of the things that really impacts Black the most. So just from, the surgical aspect of that, I wanted to be able to provide something to women that not been provided in the past. I wanted to be the conduit for equity in medicine, for Black women. And, people think that that's all I deal with is fibroids. It's not. I just women the most. especially Black women the most. But, just really trying to impact healthcare on a broad spectrum for women and unapologetically Black women, and offer them minimally invasive surgeries that they should be afforded but are not afforded just because of the systemic racism and things that we endure through our country.
Yeah, I love that, because one of my main thing is just social determinants of health, of course, with the historical racism, but other things that really just stop women from getting the kind of health care that they deserve. You even mentioned implicit bias in your bio. And that's something, sometimes we see just the effects of that ripple throughout the community. And so we appreciate, yourself and other doctors as well, including myself, who actually want to make sure that we are the atypical. We go against the grain and make sure that we're giving back to our community. So I love that. And I know you do a lot of other things other than fibroids. I'm telling you, that's what's on Instagram.
If you look at it, that's the stuff that really people, that's stuff that when I talk about pelvic prolapse or menopause or something, a snorefest, people don't pay attention to it, whatever. But then if I put a 20-pound fibroid on there, it goes
right.
So that's the reason why it's so, because at the end of the day, it's not about, clout or fame or any of those things.
Right.
It's information and about providing options for women. So if it takes the wow factor for people to say, oh, wow, this guy's on some great stuff, then.
Yeah, no, I agree with that. And sometimes, just to get, I guess, the viral or whatnot, but it really does shed light on some of the other things that you do and some of the other needs. Because I'm going to tell you, for me, my own story, I didn't tell a whole lot of people. I thought I was a healthy person. Why was this happening to me? And I'm sure even with this broadcast, I'm probably got some acquaintances that probably didn't even know I had surgery, So I wanted to take kind of the stigma off of, getting surgery and, especially even if you're at the point of health, right? Because I sometimes think people think, well, fibroids is due to your bad diet, is due to this, is due to that. And I know we'll get into a little bit later, just some of the suspected, but there's really no clear, looking at the research, clear causes, but there's things that could lend to it. But I want to actually, since we're talking about shock value, what has been one of the biggest major cases that you've had or anything that sticks out in your memory?
The 20-pound fibroid case that I had is probably the biggest case where I actually, performed this with a small incision and preserved her uterus. That case in of itself had so many different challenges, just because, one, her being from the country, which I figured out how to make that happen, but just health challenges that the fibroids cause, they to have significant pleural effusions because the fibroid was so large it was lying on inferior vena cava, which is large vessel in her body, and was fluid to back up to her lungs to where she had to have, paracentesis, or this fluid drained 6 or 7 times.
Wow.
Over the year, so to actually get her to surgery, and I had to fight, literally, not fist fight. I had to argue other providers, allow it to happen. And when I say allow, it's meaning them actually participating and doing the things. I'm not an anesthesiologist, so I can't perform anesthesia and do the surgery. So I had to convince the anesthesiologist. And to get, and that was a huge, for many barriers, many obstacles. And then, once I actually got and started removing this fibroid, the bleeding was a huge, but doing that. And then a fibroid that was attached to her bowel, and bowel, called general surgery in to come and resect a portion of her bowel, to get this fibroid completely removed,
Wow.
At the end of the day, still preserve her uterus and do it with an incision that, kept her modesty, allow her to recover and out of the hospital. So it was so many different factors. I mean, I've had some other challenging cases, but to date, that probably is the one that just sticks out in my mind, the most.
Yeah,
not
most difficult.
Easy.
None of these are easy. I'm sure none of these are super easy.
Each have challenges. So it's a lot to do. That one just had a lot of different things and obstacles.
Yeah.
So, but outside the social factors, dealing with other surgeons, there's so many people hate for it.
You mean all the doctors? You mean all of our colleagues don't have good attitudes? You really?
So like I to this day from there, I don't. It's one. I don't even talk to that lady to this day because it's just like sabotage case. I'm just like, how do you do that? It's like, what do you expect this woman to do? Like she has. If we don't do it, who's going to do it? She's been. She went to, Johns Hopkins. She went to multiple different big name institutions that refused to touch her. So at this point, I was like, she's supposed to walk around like this for the rest of her life. Like, somebody tell me something. Like, that just doesn't make sense. So, it was a lot.
Yeah. And, I appreciate that because, our patients need help navigating the system. And as a physician, I know for me, we navigate and we advocate for our patients, and you want somebody behind you who's going to advocate for you. So I really feel that. All right. Well, let's talk about fibroids a little bit more now. So in your position, what do you see as some of the biggest myths that women may have just surrounding fibroids and the treatment of them?
Oh, where do I start? So many things that people talk about. The biggest thing that bothers me is, when women that have fibroid disease have these, they get shamed to the point. How did you let it get this big? What did you do? What did you eat? It's like, it's so many things that, they blame women that have this issue. And it's other women that are doing it. It's like sometimes other women with fibroids that are doing it to other women, which really burns my soul.
Ooh, your comment section. You be coming for them in your comment.
So as much as you can talk about me, but like I advocate, for my patients, advocate for these women because it's not much that, it's a point of helplessness, to where it's like nobody understands, nobody will try to help. It's like you become a leper, if you will, with this disease. And, another thing I hear is like, telling women, you shouldn't eat meat or you shouldn't drink milk or what have you. And, though there are studies that show that the level of, women that eat meat or have meat in their diet have a higher incidence of fibroids. That's a statement. But that doesn't mean that meat is the sole cause of fibroid growth, right? So there are women that I have right now that don't eat meat, that are vegans, vegetarians, that are battling advanced fibroid disease. So it's a multifactorial disease. So for people to just say this caused it, you did this or you did that, or, it's so many things that that people just don't have any clue about. And then when you have anytime you have something that doesn't have a lot of answers, you're always going to have people that are trying to self-proclaim to either have the answer or and then in the capitalistic society that we live in, people are now trying to capitalize off of the fears and off of the misinformation. So you got fibroid teas, fibroid smoothies, fibroid belly rubs, or what have you. And at the end of the day, none of this stuff is really founded to work. It's just people making money off of people's fears. There's a lot of different things that happen that surround fibroids and the growth and the treatment that really just burns my soul, honestly.
Yeah. And I always say, as a woman, this affects our overall wellness. Our definition of wellness here, at least on this show, biblical definition of wellness is being well in your body and in your spirit, right? And you could be well in one part and not the other. And when you're spiritually well and you're going through something like this, yes, you really need to pray and get what God is telling you, but you also have to look at the different options. And when you're looking at options, you got to make sure that these are founded. If you're looking at medical, evidence-based medicine, look at for an expert to really explain these things to you so you can make that educated decision. Everybody as quiet as a cat, all doctors, we're not out here trying to get your money, You already know. I already tell people there's a lot of other things.
Like that's another thing that burns me is like people see me and they're like, he just trying to get money. I promise you.
Promise.
There's so many other things that I could do to make more money than what I'm doing right now. I don't have to do what I'm doing. Like I could coast along, and just do a case a month and still make the money. Insurances aren't paying me like that. It's not that. Or even when I get in there, like who takes out all of the fibroids? Like to sit there and automatically pick out pea-size and half a pea-size fibroid 4, 5, 6 hours. Like no one is paying me to do that. No one. There's no rainbow at the end of the tunnel for me to do that other than looking out for women and trying to do my best to ensure that they don't have to be impacted with fibroids in the future, because I take out the big ones and be done with it, just be completely, let them come back in 5 or 6 years and do it again. But I don't do it just because I'm just not that like it. It's a gift and a curse to always do the right thing, and I always do it no matter when nobody's looking or not.
Yeah. I don't know if it's a curse. That's just called walking in integrity, right? And there's a lot of people out here. It's a very rare gift to walk in integrity. But when you do, you kind of shine out. And that's a good thing. And I love what you said about that, because a lot of people, I hear that, you don't have to get the surgery because they're just going to come back. They're just going to come back. No, they're going to. And why don't you go into that? Because I know you'll have the explanation better than me.
The thing about some of my patients, you look at the data that 40% of the times fibroid surgery is going to come back and that you're going to have to reoperate or get hysterectomy in the future. That is true. The problem is that when you look at that data is mixed with people who leave fibroids behind, people that don't have fibroid skills, people that only do laparoscopic surgery, even with open myomectomies, right? I can assure you, I've seen it, I've watched it, I've had patients come with it, where it's like, okay, they'll show me the picture of fibroids, and it's like they all these big fibroids. I look at it and I say, I guarantee you, there was more fibroids in there. So those patients are mixed with someone like myself. And I try not to be as arrogant or try to sound like there's nobody like me. There's nobody that's going to systematically get every fibroid out of a person. Like literally this week, I had 3 myomectomy cases. In those 3 myomectomy cases, I've spent over 20 hours with 3 patients picking out over 200 fibroids out of 3 women. Nobody with less than 6. So I know that when it leaves off my table when I perform surgery, that their fibroids are just, there's nothing there. If there's any microscopic or a particle of a fibroid, possibly, I'm not to say that out of all these cases I have nothing left, but there's not much there. And I can safely say that. And so for me, that I know that the reproductive life of women, it's not infinite. You have so long. So the odds of, if you get all of the fibroids, the odds of you having enough time to generate a new fibroid and then allowing that fibroid to grow to where it's a huge problem are nil to none, because you just don't have enough time left to do that. So I'm not to say that if you put an ultrasound on any of my patients that there's no fibroid ever left there, because that's not true. But my concern is will you have a 8, 9, 10 centimeter fibroid that we have to worry about and have to operate on again? And the answer to that is no. And that's what I focus on. And I tell my patients, don't focus on if you have fibroid again. Will you have to come see me again? Or you have to go see somebody else again? And safely say no. In the past, 6 years of doing surgeries in this particular way, I have not had any repeat patients that I've had to go in to remove fibroids. And I'm very proud of that. But no, you can't get that from any other surgeon I can tell. They'll always say they have repeats, and that starts with getting all of the fibroid tissue out.
Yeah. And I think that's kind of what led me to you, because you were so meticulous in removing everything. Like, I had heavy bleeding, never had that before. And you removed a polyp or whatnot. Didn't even know I had that. Never picked that up on, any kind of ultrasound or anything like that. And again, the low incision, because, I was like, put that in the bikini line. I don't want to see it. You can't see it, right? So, I mean, surgery is not always a major thing, but, just the attention to detail that you have. And, I wanted to, for those of, let's go into this. What are some of the main options for folks who do have fibroids out there? What are some of the main kind of courses of treatment that are most popular that you would say, other than a myomectomy, of course? But
so, and when I give the options, just with the caveat that, like, everybody is different. Like, multitudes of different factors that go into what surgery makes sense for you. One is size, the size of your fibroid, how big they are, the location of your fibroids, if they're pushing into the cavity or they're not pushing into the cavity, the age, your age, where you're at in your reproductive life, your desire to have children, when you're trying to have children. All of these things, play a role in what options make sense for you. So, just in a nutshell, you have, medications. Sometimes medications are the bridge to kind of get you where you want to get to, where you're at in the stage of reproductive life. So medications really work on bleeding. So if you have fibroids and bleeding is your major problem, there are medications that can help with the bleeding aspect. Then you have, treatments of the actual fibroids. So urinary artery embolization, which I am not a proponent or a fan of, is basically applied to your fibroids. Again, if you talk to enough people, there are some women out there that will swear by it, that thinks it's world, but there are an overwhelming majority of women that I encounter that have had it that really are not proponents or not fans of the procedure. They've had pain, they've had issues, and they are not happy with the surgery. So I look at it like, would I tell my mama or my sister to get it? The answer is absolutely not. So I wouldn't tell other people to get it. But is it an option? Absolutely. I don't take options away from people. I just tell them it is what it is. This is it. This is my opinion. Other options. So a procedure that I endorse a lot, in full disclosure, that pays me to teach, but it's not the reason why. 'Cause I can't be bought. If it doesn't work, I guarantee you I will never endorse it. But it's a procedure called Accessa. So radio frequency ablation of the fibroid. And so the reason that I do endorse it is because I'm good at it. I know how to effectively utilize it. So I'm sure there are multitudes of women that have had it and will have a negative opinion about it, but it's levels to everything, right? It's levels to surgery, it's levels to lawyers, it's levels to engineers, it's levels to mechanics, so if you get it performed by someone is not experienced with it, you may have an outcome that's not desirable. But it's a direct treatment of fibroids, and where you're going laparoscopically, small incisions going with an ultrasound and actually treating the fibroid, and burning the fibroid, changing the characteristics of it, changing the volume of the fibroid. So that's an option. Sonata is another treatment that I don't perform, but it's similar to except it's going through through the vagina, through with a hysteroscope or a camera that goes through the bottom of your uterus, and it's doing the same radio frequency ablation, but it's up from down below. The reason that I'm not a big fan or proponent of it is because there's a level of comfort of what you can see, right? So hysteroscopically with a camera, you can only see so much. You can't see inside the belly where these fibroids are at, how you're treating you. So there's some limitations there. In the right hands, it could be very effective, but it also really kind of depends on where those fibroids are located. If you have fibroids that are pushing into the cavity, then you also have, hysteroscopic myomectomy, where you go in with a camera and a tool to remove the fibroids that are just in the cavity. The only issue with that is like, just because you treat the fibroids that are in the cavity, you also have portion of the fibroid that is in the muscle that also needs to be treated. So if you do that concomitantly, the hysteroscopic myomectomy with an accessa is also a very good treatment if your fibroids are not very large.
Right.
Then, of course, myomectomy. So myomectomy can be done open or laparoscopically or robotically. Laparoscopic and robotic are two of similar things, where small incision, minimally invasive. People are in love with that. One point in time, well, I'm a robotic surgeon. I am a master of laparoscopic surgery, but I am not a proponent of laparoscopic or robotic myomectomies. I just stopped.
Okay.
But I stopped doing that about 5 or 6 years ago, and it's a common sense thing. I'm not the smartest doctor in the world, but I have a master's level PhD when it comes to common sense, and so I stopped performing it or stopped recommending it because the key, as we just talked about, for fibroids is to remove them all. If you don't remove them and you leave them, then they can grow big and become problems. So laparoscopically, all you could do is really see. You can't feel the uterus, so you could get the big ones. Big ones are easy. But when you have a pea-sized fibroid that's in a muscle layer, as thick as your bicep, and you try to find a pea in your bicep by just looking, you're not going to see it. So therefore, you leave it, where it can be bigger, get bigger over time and become a problem. So that's one reason I stopped that. Another reason is that once you start doing myomectomies, your patient is obligated to C-sections, right? So it doesn't make sense to do an infection where you're going to leave fibroids and then turn around to do a C-section. So for me, just myomectomies in of themselves, it just stopped becoming a thing. The best treatment option to do robotic myomectomies is not to say in today's time I would not do a robotic myomectomy. If someone really pushed me and wanted me to do it, I would say absolutely. But I would have them with a very clear understanding that if and when you have to come back for the surgery again, you won't say P did this and he didn't offer me, because it will be very clearly depicted in your chart. And that this was very clearly stated to you, because people forget a lot when they want something, and even if someone tells them that doesn't make sense, they'll forget over time. And I pride myself in being able to assure my patient that it's extremely unlikely that they'll have to come back to me for surgery again for fibroids, to not worry about them. And they hear these things from other doctors, which are fine because they're going off the literature. And for me, I go off the literature as well too. And I'm evidence-based, but I also go off my own evidence. And my own evidence shows me that, when I am meticulous and get all the fibroids out of a patient, that the likelihood that they're going to come back to me for surgery is nil to none. And I make an incision that, one, is very cosmetically appealing for them. Something that you can wear, your panties, your bikinis and things, that it's hidden below that line so that you don't have to explain this incision. And the incision is also to the point where it's so thin and heals well to where you don't have to be cognizant about it as well too. I think that is an aspect of medicine that most people don't think about, just like the psychology behind, a person going through something so traumatic and then getting a constant reminder of what they went through.
Right.
So, I focus on the cosmetic aspect of the surgery, and also tying that into the future of the patient and their ability to have children and how that's going to play out. So myomectomy, of course, is an option. And again, if someone is done bearing children, and fibroids are an issue, hysterectomy is always on the table. It's always an option. Hysterectomy is always a bad word. It has bad connotations to it. But part of my focus too is also to expose why things have bad connotations, and also to be like a beacon of light for the way things should be, and to take the fear out of other people's experience or out of our past traumas and take that out of the equation so that people can make the best decisions for their lives, because hysterectomy sometimes is the best option for you, just depending on what you want. If your desire is to be done with the bleeding, the pain, and you don't have a true desire to have children, then hysterectomy should always be placed on the table, and a minimally invasive hysterectomy at that. So all hysterectomies that I do perform are either laparoscopic or robotic. So that's the aspect of that. So even though I don't really endorse robotic myomectomies, I always endorse laparoscopic or robotic hysterectomies. So those are the treatment options, top to bottom.
In a nutshell. But no, I love what you said. You made a statement about in fear, because I think that's what a lot of Black women will go through, is a lot of fear around uncertainty, and then that's why I wanted you to go through all the treatment options. Because one thing, I do not want people to do things out of fear, out of not knowing. And I know there's a lot of women out here who just think I just have to get a hysterectomy, because when they have a consultation, especially if they have advanced fibroid disease, that is the only option that they're given. Like a 35-year-old who wants to have children, you got to get a hysterectomy. Yeah, it's crazy. It's crazy. But and for some of us, that's what. No, I'm not 35, but almost there. But for some of us, that's what the options were. So there are many other options with that, right?
35-year-olds right now couldn't even sniff a half marathon. So you are as old.
I'm saying. Now I always got to say, wellness is in your mind. That's why it says the mind and the spirit and the body. You got to take care of yourself. So one other thing I wanted to touch on, I actually went to Chicago. I actually did some medical tourism, by going to another state. And I know you have many other patients that do that as well. But one of the things that maybe make me unlike some of the other patients is that I have a medical knowledge and medical background. Sure. So if you're looking for if someone is considering a myomectomy, and a myomectomy, we've been kind of shooting out that word, but that just means fibroid removal, right? Fibroids from they're non-cancerous tumors of the uterus. So it's just removal of those fibroids. What should they be looking at for a surgeon if they're not able to go to another state or see you? What kind of things should they ask a surgeon in that consultation?
Perfect question. And so, one thing I say is that, everybody's not on social media. Everybody's not, doesn't put their life or their profession on social media, and that's fine. However, many people are. So if you're researching your doctor, social media is fair game. Their activity over the internet is absolute fair game. So that's the first place I would start. Look at their social media page. If they're just talking about their family and it's very personal, what have you, so be it. If it's private, so be it. But if it's very public, right, and they're posting pictures about, in Greece and Japan or what have you, they should be very passionate about what they're doing, right?
Right.
My page is very minimal about my family and about my personal life. It's more so about my passion for helping people. So to me, that would be one of the things that I would look for providers, to see how passionate are they about what they're doing, right? So that's the second thing is I would say, really talk to patients that look like you, right? So I was like, for me personally, my patients, I really have a very open rapport with them. Like, I'm doing podcasts with one patient right now. That doctor should not be, maybe not because of HIPAA and all of those things, maybe not be allowed to give you full access to all their patients, but they should have like a patient or two that is similar to you that you could talk to and kind of get some comfort and understand what the process looks like. I don't think that that's too much to ask. And if they do the surgery enough, they should have a patient or two where they can you can lean on for some guidance and hear some things. I would ask them too.
Mm-hmm.
The most important question is how many surgeries have you had to convert to hysterectomy?
Wow.
How many times you went to a myomectomy and you've had to convert it to a hysterectomy? It's a very fair question. And if they have a problem with answering that question, then that's a red flag.
Wow.
Ask them what their take is on cosmetics. Like what surgery needs a vertical incision? Do you believe in vertical incisions? What's your approach to the cosmetic appearance of a patient? Like, how on a scale of importance, like, is that important to you? Ask them that. Mm-hmm. Ask them what's their philosophy on fibroid removal. Like, do you just remove the ones you're comfortable with? How many do you remove? Like, when they get too small, like, do you want those removed, or what their approach is? That's a question. Another question is what is their approach for restoring the cavity of the uterus?
Okay.
Uterus, do they remove those fibroids, or do they leave them? Or, if the cavity is damaged, what is their approach to repairing the cavity to ensure that a person has ability to get pregnant in the future? These are very, very specific questions, but these are very fair questions that if you sit down and you ask, someone that is a fibroid expert or a gynecologic surgeon, they shouldn't have problems with asking those questions. I love when patients ask me those questions. That gives me a time to talk my stuff. Like I can say, confidently, these are my results. These are the things that I do to give them the confidence in me, because it's not so much, it's a gaining of trust, right? Like, you shouldn't just trust somebody just because they got some letters behind their name. Like, they have to earn your trust. Like, you're for 4, 3, 5, 6 hours, like, they're literally, you are defenseless. You're in your most vulnerable state. That person has your life in their hands. 1 millimeter left or right, false move, sneeze, cough, you could have major problems or even death. So if you're going to trust that person, they have to earn that trust from you. So that conversation needs to have some questions that really kind of checks them. Like, if somebody was going to take your kids to school, or take your mama, or going to your mom's house and do something for her, you trust them first, right? So why would you let somebody go into your belly and have you in your most vulnerable state that you'll ever be in without trusting them fully? So these are some of the questions that I would suggest that someone ask a person to see if they're a good fit for surgery.
No, I think that's awesome. What you just said about the trust level. This is for any doctor. If you're doing surgery, if you're seeing an internist, you should be able to ask your doctor questions, and them not get offensive. And it's okay to have second opinions. Okay. And I will say, most of us, and we talked about this, some other episodes as well, with one of our favorites, Dr. Heather Benson. But we talked about doctors are not the enemy. But, you want to have a doctor that you have a good relationship with, a good rapport. And if you feel that person is not open to answering questions or even saying, I'm not sure about that. Let me get back to you. That's an issue, and there's a lot of folks out here that can perform your surgery or be your primary care doctor or what have you. So, do your research, do your research, do your research. All right. Well, very good. Well, Dr. P, we know that you are so busy. And thank you so much. Yes, I was a patient. And yes, I kind of was like, okay, you got to do my show. Because like I said, I'm on a whole journey to wellness as well, along with a lot of the audience out there. And I think when you think about physical health is so important along with the spiritual health as well. And then if there's something going on in your body, don't suffer in silence. Get the information that you need. Ask questions. And of course, if you're looking for like fibroid consultation, of course, I would recommend Dr. P, because most folks I have on this show are people who are very educated in their fields, but they also really care about people. And I can tell you my whole surgical experience, I felt that Dr. P answered all of my questions. I felt very, very comfortable, even in the hospital. And my post-op, like I said, I was out and doing what I need to do in like 2 weeks. That's just me though, because I was healthy before y'all. Y'all heard me. I was healthy before.
You should be, like, surgery should be done in a way to get you back to your life quickly. Like, it shouldn't be morbid. It should not be, debilitating. Like, and that takes a level of sacrifice from your surgeon too. Because it's very easy to cut someone open and make it convenient. It's much, much harder to struggle and to go through things and worry about, recovery, worry about future scars and healing and those things. Like, it's difficult for a surgeon to do that. But it's you get into it because you're invested in people. And that's what you want. You want somebody that's going to be invested in you as a person, not just another case, not just somebody that they're going to operate on, just you as a person. That's extremely important. So if you don't feel that this person is invested into your well-being and your life and who you are, then like don't trust that.
Right. Absolutely. Absolutely. And then, of course, for people of God out there, you need to pray about it. You need to have some peace about it and go where God leads you. Definitely. Definitely.
Huge.
All right. Dr. P, thank you so much for being on the show. And can you let us know where folks can find you on social media and your website as well? We'll have it listed, but go ahead and say it.
Social media, it's Dr. Spell out Dr. DLCTORP. 23, that's IG, that's TikTok, Pierre Johnson MD on Facebook, and website is www.fibroidslayer.com. So if you look up Fibroid Slayer, you'll find me, virtual consultations, anything. Like, I'm not hard to find. If I can be of help or blessing to anybody, I try to do it. I'm very approachable. People DM me all the time, send me emails. I'm not all about the dollar. Like, I really try to help people at the end of the day. So, if people need help, just reach out. Just simple.
Mm-hmm. All right. Well, thank you so much, Dr. P. And again, for our audience out there, please follow him on Instagram. And, if you know anyone in your life that is feeling ashamed of fibroids or needs some help or just some good information, definitely go check out Dr. P. And also, if this show has really meant anything to you, have any further questions, go ahead down below. You can reach me at info@drlaurencarroll.com. That's info@drlaurencarroll.com. And then you can also check out my website, drlaurencarroll.com, and you'll see that there's a link for a free 5-day devotional, just talking about how to get a mindset to receive health or receive wellness. All right. So thank you so much, Dr. P, and everyone else. We will see you soon for our next Wellness Watch. Y'all take care. Mm-hmm.